Without a doubt, we've got somebody here, and her name is Dr. Dena Grayson. And first of all, thank you for joining us. We appreciate the time.
Hey, guys. Thanks for having me on the show.
So you are a doctor, you're a PhD, you're a scientist, you're an expert on pandemic threats. You know about all this stuff, and you're watching it all unfold right now, Dr. Grayson. On that freak-out scale from 1 to 10, where are you?
Well, I haven't had time to freak out. I've been watching this since late December and saw that this virus was extremely dangerous and frankly was alarmed back in December. And really it was about mid-January where I raised the alarm publicly because I saw what was happening in China, where, look, they completely lied about the number of people that died and were infected. But when you see them suddenly building a 1,000-bed hospital in 10 days, it's pretty obvious what's happening. And look, this thing spreads very, very easily. And it was very clear that this had pandemic potential, unlike something we've, certainly never seen in my lifetime and nothing we've seen since the 1918 Spanish flu pandemic that killed 50 million people.
Now, when you saw it in December, though, did you have any idea that it would turn into what it's turned into?
Yes, and that's why I was alarmed. And in mid-January, I have a very large Twitter following at drdenagrayson.com, Dr. Dena Grayson, I should say, and about 250,000 followers now. And I started raising the alarm in mid-January because I saw that this virus, look, there's 3 things you look for. It spreads easily. It can cause serious disease or death in otherwise healthy people. And there are no treatments or vaccines. So we can't stop it. We can only hope to contain it. And it was only a matter of time before it breached our shores. And here we are.
So, Dr. Grayson, let's go over some stuff because I know people have a lot of anxiety and they have a lot of things on their minds. What is a coronavirus? And explain, is this like the flu? So many people are saying that. You see that argument everywhere. What is a coronavirus and what's the difference between it and the flu?
Well, it's a virus like influenza, but, and the coronaviruses are like a family, all right? There's different flavors, if you will. Okay, so there are different coronaviruses that circulate around all the time in humans, and they cause about 1/4 of common colds. Now, this specific one is different because it appears to have jumped from an animal to humans. Mm-hmm. So our immune systems haven't seen it before. So we have no immunity. So it spreads like wildfire and causes very severe disease. So like influenza, it has most coronaviruses, we don't know what this one, tend to be sort of seasonal, right? Worse in winter, a little better in summer. But unlike seasonal flu has a mortality rate around 0.1%.
Yeah.
Okay. And there are treatments and vaccines. This one, right now, the mortality rate is listed around 3.5%. That's 35 times higher. Now, in reality, is it that high? Probably not, but we know that it's much, much worse than typical flu. And there's nothing that if you get it, most people have a mild infection, but if you're severely ill, there's no treatment, and we can't prevent people from getting it.
Yeah, well, Dr. Grayson is an expert on pandemic threats, so this is right in her wheelhouse. Now, when we talk about the coronavirus, as we start to see all these shutdowns and businesses are closing and theme parks are closing, and people start to look at themselves and their hands and everything they're touching, what are the ways that you can get this virus? Is it something that if you're just in the same room with somebody, it could be airborne? Does it require touch? What are the ways that you can actually get this?
A lot of this is still being determined because it's a brand new virus. It certainly it can be airborne, but measles is different. Like measles is really, really contagious. So if somebody sneezes in a room and you walk in the room an hour later, you can get it.
Yeah.
This virus, it's very unlikely. Now, if somebody is like a physician or a nurse where they're treating sick patients who are sneezing and coughing and, spraying germs on them, they can certainly get this via the airborne route. But, it's thought that this is probably more likely in the general population via touching stuff, and that is called fomites, where basically when the virus sits on an inanimate object, then you touch it and then you touch your face.
Yeah.
So that's the bad news. Now, the good news is soap. Soap destroys this thing. So that is it. Like, people are spending all this money on hand sanitizers
and toilet paper.
Right. For whatever reason, I mean, there's a run on toilet paper because I don't know. But actually, simple old soap and water is the best deterrent. And it's difficult, but try not to touch your face.
So
I mean, that is so hard.
We talked to somebody, and to me, he just sounded like an absolute crank, Dr. Grayson. And this guy said,
"Oh man, it was insane."
Excuse me for being crass. He said, "Look, if somebody's farting near you, you could get coronavirus. If you walk into a bathroom, if somebody's been in there and they've had coronavirus, you could get the virus."
You know, blaming a lot of it on the septic system in China.
Well, no. Now with SARS, there was a whole apartment building that had a faulty sort of septic line, and that was transmitted because when people were flushing the toilet, it was basically spewing up, into the air.
Yeah.
So that's a very special circumstance, but fortunately in the United States we don't have that issue. So people don't need to worry about using a public restroom and that, oh my gosh, if I go in there and I flush the toilet, it's going to spray the germs on me. Very, 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 very unlikely.
No.
But if you touch a doorknob after somebody just wiped their nose and then touched that door and you touch it and wipe your nose, that's how we often get common colds.
Yeah. Mm-hmm.
Now, there's also been another warning that I've seen make the rounds the last 48 hours that people who smoke or vape are more susceptible to COVID-19 than someone who doesn't. Thoughts
on that? Well, it's too early to say specifically if those are risk factors because we haven't had that many, I should say, documented cases in the U.S. Because we don't have good enough testing. But certainly what is known is that people who have underlying chronic lung disease, they are at increased risk for having very serious illness or even death from this coronavirus. And smoking certainly increases your risk for chronic lung disease. So that's probably where that is coming from.
Now, this is kind of unrelated to the smoking part because thank you for that answer. As far as the tests, we have very little of them, but what does it take to test or at least make a test for coronavirus, and why aren't they mass producing it at this point? Is it comparing it to an active coronavirus molecule, or is it like when you check for chlorine in the pool and you wait for that color to change?
Sabrina, that's great. It's somewhat in between. So the test involves isolating the virus's genetic material, which is called RNA, and analyzing that for specific sequences. Now, the reason why we are so behind the eight ball is very simple. It's called lack of planning. Now, unfortunately, the federal government decided that for whatever reason, this coronavirus was not a threat. Hear no evil, see no evil, have no pandemic.
Just wanted it to go away, right? Just
correct. It was like political spin, but the problem is you can't spin death. Okay, you can't. And then where there was this announcement of, there's 1 million tests. Well, if this is not like getting an Amazon box where you get the thing, you open it up and you plug it in and it works. That's not how these tests work. To roll out the test, you have to sort of do all this scientific validation. But on top of that, you have to have protective gear for the workers because they're handling potentially deathly samples.
Yeah, imagine that job. So when you get this, and we now know, Dr. Grayson, that you got to watch out for surfaces you're touching and all these things that are around you. And how long do you think it lasts on those surfaces, real quick?
Well, there's been some studies showing that it actually can last for days, believe it or not. Now, whether or not, there's like a decay factor, right? So, maybe after an hour you touch that surface, you can still get the virus. But, 3 days later, if you can detect the virus, that's one thing versus are there enough virus particles there to make you sick? No one really knows. So that's why it's wash your hands.
So if you do get sick, if anybody listening ended up getting sick and they got the coronavirus, what is going to happen to that person? I've seen some people who, honestly, we play audio with them and they go, I didn't even know I was sick. I didn't even feel anything from it. It almost seems to me like there's two strains or something, because then you see people who have a lower respiratory infection that seems god-awful. What is the average person going to go through if they get the coronavirus?
Yeah, so it's another great question, and it's highly variable. So the symptoms are like a flu, but tend to be lower respiratory symptoms, so fever, cough, and shortness of breath. And shortness of breath in particular is something that, coupled with a high fever, is very worrisome, and people should seek medical attention. Now, I think one thing important for folks to know is that this is not a death sentence, okay? So that 80% of people who get the coronavirus have a very mild infection. And the real number is probably much higher than that, because if it's so mild, you don't even ever seek medical attention and get tested, right? So at least based upon information coming from China, 80% of patients that were diagnosed had mild infection, and about 20% have more severe infection that requires hospitalization. And that could be anywhere from needing oxygen and some IV fluids to, unfortunately, about 5% of people get critically ill, need to be on a ventilator.
Man.
So this is one of the challenges, right, is if we have a bunch of people infected all at once, and this is happening right now in Italy.
Now, does the coronavirus cause COVID-19? Is that how it works?
That's exactly right. So
Okay.
this novel coronavirus causes the illness, and they've deemed that COVID-19.
Are we freaking out not enough or too much?
Well, until recently, we haven't freaked out enough, quite frankly. Look, here's what happened. Look at China. China stuck their head in the ground, and many, 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 many thousands of people were infected, many more than were reported. I mean, every expert, including me, knows that it was more than 80,000 people that were infected, and many, many thousands died. In Iran, they are digging mass graves.
I've seen the photos of this.
The lengths of football fields, okay? Now, Italy, I think we could all, some of us have been to Italy. I've been to Italy. Italy is a place that has actually a very good health system, and the wealthiest part of their country, the northern part, their hospitals are overwhelmed, and the doctors are now having to choose who lives or dies, okay, who gets on a ventilator, who doesn't. So they acted too late to shut things down.
But didn't we act too late?
We haven't acted until recently. And the problem is we didn't have testing fast enough. So there wasn't information. And now we know we have multiple hotspots in this country. We've got, the Seattle area is a hotspot. We've got hotspots in the New York City area. One guy in New York City, in New Rochelle, that one guy infected at least 50 other people.
Wow. Holy cow. So that's an R naught even higher than anything that's been discussed on it. It was one specific case. But so what needs to be done that's not being done, Dr. Grayson?
Well, I just had an op-ed that published in the Boston Globe about an hour ago, and I'm calling on massive nationwide lockdowns. And I'm not a fearmonger. I'm just looking at the evidence, and I want to protect people. So federally, what we need to do is close the schools temporarily. We've got to do that. We've got to, now we're seeing the mass gatherings that are stopping, but with that, we need a mandate coming from the federal government saying, look, no more of this. We just got to stop the mass gatherings, pause for the rest of March. Let's see where this thing goes.
And what do you mean? Do you mean like when you say mass gathering? I mean, obviously they've said in some cases over 250 people, or they've said different numbers. What about things like when it's lower than that? When maybe it's 50 people at a restaurant or something? Does that need to stop?
Well, it depends on the area you're in. So I would say right now across the country, large gatherings above 1,000 people, no more. Okay, just let's pause. And even things like religious ceremonies, church, synagogue, whatever you go to, probably not a good idea, especially if you're high risk. So for high risk folks, you're above the age of 60,
and
you have one of these underlying medical conditions. Yeah, I was telling my mother-in-law, look, we were going to have a family gathering. It's my husband's birthday today. We've got 3 of 5 kids' birthdays this coming week. And I love my mother-in-law. She's awesome. And I said, look, I love you and I don't want to kill you. So she's like, you're right. And so she's not going to be attending religious ceremonies for a while, services, because she said, look, this isn't a risk worth taking. But I think in specific areas where there are known hotspots, look, if we wait to act too late, if you wait until the patients start flooding the emergency rooms, we know that this virus has an incubation period. So you're going to be behind the curve if you wait for the patients to start flooding in.
Yeah.
That's what happened in Italy. That's what happened in China. So we've seen this horror show before. So I think that we need to act now and say, look, across the country, let's just not, the kids don't get serious illness, but they spread it to everyone else around them. They're little viral vectors. So let's just,
they are.
right? Let's just pause. Let's keep people away from large gatherings. Here in Central Florida, we're not a very urban area. So you don't need to say to people, stay in your homes, because you can go outside and you're not going to be like elbow to elbow with people. But what about New York City?
Yeah.
I mean, in New York City, you run into 5 people walking out of your apartment.
What?
So that's a different place where, look, encourage businesses to have people work from home. Government agencies that are non-essential need to just say, look, work from home. We've got to think about this aggressively now, because the later we wait, you end up in a situation like Italy where 60 million people are on lockdown in their homes.
Yeah, and there's a lot of the working from home stuff going on now. I want to bring a question in, because I think a lot of people are interested in this, and this is kind of a thing that scared some folks. Brian, you got a question for Dr. Dena Grayson, an expert on pandemic threats. So what's your question?
Yes, sir. Once you get the coronavirus, can you get it again? We're hearing different stories about that. Can we just get it and get over it and be done with it?
Or can you get it twice? Because there have been...
Yeah, no, Brian asked a great question, and I get this question a lot. So there's been some misinformation spread around about that, Brian. So it does appear that if you get this virus, the vast majority of the time, people are going to survive. They're going to, have an infection mild or even a little more serious. They're going to get better. And then you should be immune. There's been some little case reports of somebody who tested positive after having the virus. But what was thought to be going on there is the patient clinically was doing better, but was still shedding some virus. So they still had the virus in their system, but they were still in the process of clearing the virus. They haven't, because the virus can kind of linger around, it looks like, for even up to close to a month in people. But even though clinically they appear totally well, so it doesn't appear that you can get reinfected. So that's the good news here. It's sort of like, a natural vaccination, if you will.
So go ahead.
What concerns me is that when you're, especially in Central Florida right now, we're dealing with insane allergies and pollen, and are people ignoring actually having symptoms of coronavirus because they think they're just having their allergies? Like me, for example, I sneezed like 400 times the other day, but it felt like an allergy. But is it possible that maybe I'm misinterpreting it?
Probably not. I mean, the coronavirus really, people know their allergy symptoms, right? You have the kind of itchy, runny nose and watery eyes. And with the coronavirus, again, the things that are, this virus really has a predilection. It likes to go to the lower respiratory tract, so into your lungs, and cause bronchitis and pneumonia. So that's why you look for things like a fever, cough, shortness of breath. Those are really the symptoms, truly the flu-like symptoms. People report kind of feeling achy and tired on top of that. And I think people know when you have the flu, it feels pretty different than having allergies.
I want to ask you what I think is one of the biggest questions right now. How long until we see a vaccine?
Gosh, I wish I had great news on this, but, unfortunately, we're looking at least a year.
What?
And so, look, if I were the coronavirus czarina,
we were going to call you that regardless. Okay.
Rock on. I love it. Yeah, I'll be all right. Dr. Dena, the coronavirus czarina. Kind of rhymes, yeah. Dr. Dena, the coronavirus czarina. All right, I kind of like that. So if I were the coronavirus czarina, I would launch a Manhattan Project now on a vaccine. So what I mean by that is normally what you do is you sort of make a little couple, enough test doses to figure out if the vaccine is first safe and then effective. And then once you determine that, then you ramp up and do massive production of enough doses to inoculate tons of people. I would do everything at risk. So what I mean is I'd say to the top 3 vaccine candidates and say, okay, we've got 3 really good shots on goal. We don't know which one's going to work. Maybe all are going to work. Maybe only 2 or 1 are going to work, but probably 1 will work at least. Let's start manufacturing now at risk. Even though it's going to cost us a lot of money is better than lives. Mm-hmm. So let's manufacture everything. So then once we get the clinical trial data showing that vaccine's safe and effective, now we just, bam, that next day, let's go. Let's start vaccinating people. I mean, again, we need to mobilize now.
So I want to run through a list of things and tell me if you would do these things with the coronavirus pandemic happening around us. Tell me if you would do them or not. Would you shake hands with anybody, Dr. Grayson?
Absolutely not. No way.
Okay. What about, would you go to...
Elbow to elbow.
Is the elbow thing good?
Elbow things are fine. I don't think people are taking their elbow and wiping their nose. Right? That's why elbow to elbow is cool. I've also seen these great foot taps that people are doing, which is kind of cute. I don't know if you've seen the videos on social media where boop, 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 boop. And, it's like, that's kind of neat too.
Would you fly right now?
Well, I was up in New York earlier. I was in the hot zone, right? I went.
What are you doing?
In New York City. I had meetings I could not put off. So I had already planned. I'm a pandemic expert by night and by day, but I also am a cancer medical researcher too. So I sort of wear a couple of different hats. So I had some meetings there that I could not cancel, which was interesting being in New York for sure. So, but I will say this: now I am not doing any non-essential travel. My strong advice to everyone is, if it's non-essential travel, don't do it.
What about going to a restaurant?
Again, here in Central Florida, probably okay if you're young and healthy. If you are in a higher risk group, don't do it. Right? So again, older folks, high risk folks, try to avoid public places for the foreseeable future.
So the last question I have for you, Dr. Grayson, and thank you so much. This has been really helpful.
Incredible.
Yeah.
Thank you.
And we really appreciate it. Plus, you're right here in our backyard. So
you're my new doctor. I hope you're excited.
If you would be willing to come on and check in with us sporadically to kind of walk Central Florida through this, that would be incredibly valuable to us if you were available for that. But
you got it. Absolutely.
Awesome.
Happy to help. And look, we didn't talk about this, but I'm a native Central Floridian, born and raised in Brevard, state champion soccer player, went to University of Florida for my undergrad. Obviously I'm a card carrying nerd. I try to hide it, but I want to get out good information for people because I know people are scared. It is scary. It is scary, but it's not a death sentence and we will get through this, but people need to be armed with good information and make wise decisions. I'm not saying, sit in your home for the next 3 months and don't do anything. But if you have family members, if you have neighbors, if you have loved ones who are at high risk, I highly encourage you to help. And maybe you can go and buy their groceries and run some errands for them. And when you enter their house, wash your hands immediately with soap and water, 20 seconds, and encourage your loved ones to do that as well. Because, we got to help each other as a community. And frankly, as a human race.
What about the medical mask? Yes or no on those? Is that worth it?
No, yeah. People kind of in Asia, it's like a fashion statement.